Hello and welcome to Bedtime History. Tonight we embark on a journey not to a distant past of myth and legend, but to a time frighteningly close to our own. We are not visiting a haunted castle or an ancient cursed tomb. Instead, we are stepping through the automatic sliding glass doors of a modern institution, a place that should represent the pinnacle of reason, a sanctuary of science standing defiant against the chaos of human frailty. We are going to a hospital emergency room, but the story that unfolded within its brightly lit, sterile walls on one particular winter's night is a story that aggressively, violently rejects reason. It is a story that seems to tear a jagged hole in the fabric of our scientific understanding, leaving behind a chilling narrative that feels less like a medical case study and more like a terrifying dispatch from a dimension we were never meant to witness. This is the story of a woman's final desperate hours on Earth. A woman whose dying body seemed to inexplicably become a vessel for something hostile, something that lashed out with an unseen, insidious power against the very people who were fighting with all their skill and compassion to save her life. It is the story of dedicated doctors and nurses, heroes clad in blue scrubs, who ran towards a medical crisis only to be felled, one by an invisible force that defied all medical and chemical categorization. It is a story that, even now decades later, remains stubbornly lodged in the public consciousness and the annals of forensic science as one of the most baffling, terrifying, and fiercely debated medical mysteries of our time. Tonight, we begin our exhaustive investigation into the case of Gloria Ramirez, the 31-year-old mother of two from Riverside, California, who would posthumously be branded with a chilling and unforgettable moniker by the world's media, a name that still sends a shiver down the spine: the Toxic Lady. This is the first part of our deep dive, focusing with forensic precision on the nightmarish events of that single fateful evening. An evening that began with the familiar, controlled chaos of a weekend shift and ended in a full-scale hazardous materials incident, leaving a major hospital evacuated, a team of elite medical professionals mysteriously poisoned, and a human body so feared, so profoundly contaminated by an unknown agent, that it had to be sealed in a specialized aluminum casket as if it were radioactive waste. Before we step into the eye of the storm, into Trauma Room 1 on that night, we must first understand the world in which this impossible event took place. Let us paint a picture of Riverside, California, in the year 1994. Riverside is the sprawling heart of what is known as the Inland Empire, a vast suburban and industrial expanse stretching east of the urban behemoth of Los Angeles. In the 1990s, it was a place of contrast. It was a region of booming growth, of new housing tracts pushing ever further into the desert landscape. Yet it was also a place with deep agricultural roots. It was a place of sun-drenched, palm tree-lined avenues, but it often lay under a hazy blanket of smog, trapped by the surrounding mountains. It was a working-class city, a place of families striving for a piece of the California dream, far from the glamour and glitter of Hollywood. At the heart of this community stood Riverside General Hospital. In 1994, it was the county's primary public hospital, the safety net for the region's poor and uninsured. It was a busy, often overcrowded institution that served as a critical training ground for medical residents from nearby Loma Linda University. It was a place that saw a constant, relentless stream of human suffering. Its emergency department was the front line. It was a place of immense pressure, of life and death decisions made in seconds, often with limited resources. The doctors and nurses who worked there were not just skilled. They were tough, resilient, and accustomed to dealing with the most extreme situations imaginable. They were not easily rattled. They were professionals who had seen the devastating results of car crashes on the freeways, the brutal aftermath of gang violence, the tragic consequences of drug overdoses, and the quiet, creeping toll of disease. They had, by every reasonable measure, seen it all, or so they believed. Now, let us turn to the woman at the center of this storm. Before she was a headline, before she was a medical mystery, she was Gloria Ramirez. It is essential that we remember her not as a phenomenon, but as a person. Born in 1962, she was, by all accounts, a beloved wife and a devoted mother to her two young children, a son and a daughter. She was described by her family as a warm, outgoing person, someone who enjoyed being a homemaker, someone who readily volunteered at her children's school. She was a woman with a life, with hopes, with fears, with a future she was fighting for. But for some time before that night in February, Gloria's life had been overshadowed by a terrible diagnosis: advanced cervical cancer. The specific diagnosis was stage IB, meaning the cancer had spread from the cervix to the pelvic wall and/or was causing significant kidney problems. This was not an early-stage cancer. This was a brutal, invasive disease, and Gloria was engaged in a desperate fight for her life. She was under the care of oncologists, undergoing a grueling regimen of treatments. She had likely received both radiation therapy, which uses high-energy rays to kill cancer cells, and chemotherapy, which uses powerful drugs to attack the disease systemically. These treatments, while life-saving, are a form of poison themselves. They are designed to be more toxic to cancer cells than to healthy cells, but the toll they take on the human body is immense. Patients often suffer from extreme fatigue, nausea, hair loss, and a compromised immune system. Gloria was also living with chronic pain, a constant, gnawing companion that is a hallmark of advanced cancer. The cancer was causing a blockage in her urinary system, leading to kidney failure, a condition known as uremia. This buildup of toxins in her bloodstream would have contributed to a state of chronic illness, confusion, and discomfort. It is in the context of this immense suffering that we must introduce a controversial, but potentially crucial element to her story. According to her family, in an effort to combat the relentless pain and perhaps the cancer itself, Gloria had been using a substance that was popular in alternative medicine circles at the time: dimethyl sulfoxide, or DMSO. DMSO is an industrial solvent, a byproduct of the paper manufacturing process. It has a strange, almost magical ability to penetrate the skin and be absorbed directly into the bloodstream. In the 1970s and 80s, it gained a reputation as a kind of miracle cure for a wide range of ailments, particularly arthritis and muscle pain. Proponents claimed it could reduce inflammation and relieve pain. The FDA, however, had approved it for human use only in a very limited capacity, for treating a rare bladder condition. For all other uses, it was unapproved and considered an experimental drug. Crucially, DMSO is known for two things. First, when absorbed into the body, it is metabolized into other compounds, one of which, dimethyl sulfide, is excreted through the breath and skin, producing a powerful and distinctive garlicky odor. Second, it was often sold not in pharmacies, but in hardware stores or through mail order, in the form of a gel or a cream. It was a home remedy, an act of desperation for someone in unbearable pain. Whether Gloria Ramirez was using DMSO, and in what form, would become a central, fiercely debated question in the investigation to come. But for now, it is a key piece of the puzzle of her physiological state as she entered her final hours. Now let us meet the team who would be a part of her final story. These were not anonymous figures in scrubs. They were individuals with their own lives and careers, who were about to be thrust into a nightmare. The leader of the resuscitation effort was Dr. Julie Gerchinsky. She was a senior medical resident, meaning she was a fully qualified doctor in the final stages of her specialized training in emergency medicine. To be a resident at a place like Riverside General was to live a life of chronic exhaustion and immense pressure. The hours were punishing, often exceeding 80 or 90 hours a week. The responsibility was immense. But Dr. Gerchinsky was known as being exceptionally bright, capable, and calm under pressure. She was on the cusp of a promising career. Working alongside her were nurses like Susan Kane. Kane was a registered nurse, an experienced veteran of the ER trenches. She was the kind of steady hand you wanted in a crisis, someone who could start and pour on a difficult patient in the midst of chaos, someone who had seen thousands of cases and was not easily flustered. And there was Maureen Welch, the respiratory therapist, whose job was to manage the most fundamental aspect of life: breathing. She was an expert in airways, ventilators, and oxygenation. There was also Dr. Umberto Ochoa, another physician in the ER that night, and a host of other nurses, medical students, and orderlies. They were a team, a machine built to save lives. On the evening of February 19, 1994, that machine was running smoothly. They had handled the usual Saturday night procession of cases, big and small. The rhythm was established. The night was routine. Until 8:15 p.m. That was the moment the piercing wail of an ambulance siren sliced through the cool night air, its pitch rising as it screamed up the driveway to the ambulance bay. The radio in the nurses' station crackled to life. The paramedics were calling in their report, their voices clipped and strained with urgency. They were inbound, code 3 lights and sirens, with a 31-year-old female, GCS of 13 in VTACH, with a history of cervical cancer. The medical shorthand painted a grim picture. A patient who was confused and disoriented, whose heart was beating in a frantic, life-threatening rhythm. The ambulance gurney burst through the ER doors, a whirlwind of motion and grim purpose. On the gurney lay Gloria Ramirez. Her dark eyes were wide, but they seemed unfocused, darting around the room with a mixture of terror and confusion. Her breathing was shallow and incredibly rapid, a desperate, inefficient panting for air that wasn't enough. She was trying to speak, to answer the paramedics' questions, but her words were slurred and disjointed. The ER team, led by Dr. Gurchinsky, immediately took over, a seamless transfer of care. This was their domain, their battleground. They deftly moved Gloria from the ambulance gurney to a hospital bed and wheeled her into Trauma Room 1. This room was the heart of the ER, the inner sanctum reserved for the most critical life and death cases. It was a small, starkly lit chamber, its walls lined with the machinery of resuscitation, the defibrillator paddles hanging on the wall like a sacred totem, for poles adorned with bags of saline and medication, complex cardiac monitors with glowing screens, and stainless steel trays laid out with sterile instruments. For the next 37 minutes, this small, unremarkable room would become the epicenter of a scientific horror story, a stage for events that would baffle the world. The team swarmed around Gloria, a symphony of urgent, coordinated action. Every member had a role, and they performed it with the fluid efficiency born of endless training and repetition. Susan Kane, the experienced RN, began the difficult task of establishing an 4-line in Gloria's arm, a challenge as her blood pressure plummeted and her veins began to collapse. Maureen Welch, the respiratory therapist, stood by Gloria's head, preparing to intubate her, to slide a breathing tube down her throat and connect her to a ventilator that would breathe for her. Dr. Gurchinsky and Dr. Ochoa began a rapid assessment, their voices a calm but quick exchange of numbers and orders. Heart rate over 130. Blood pressure 100/60 and falling. Resps at 38. They were in a race against time. They followed the established protocols, the life-saving algorithms of advanced cardiac life support, to the letter. This was a textbook case of ventricular tachycardia, and they responded with the textbook treatment. They pushed a cocktail of powerful drugs into her system via the 4-line. Valium and Versed, benzodiazepines to calm her extreme agitation, and the seizure-like tremors that were racking her body. Then came the antiarrhythmics, lidocaine and then beryllium, drugs designed to quell the electrical storm raging in her heart and hopefully shock it back into a normal life-sustaining rhythm. But Gloria was not responding. Her body seemed to be sliding inexorably towards death, resisting every intervention, every powerful drug they poured into her. Her heart rate, tracked on the glowing green line of the monitor above her bed, careened wildly. The rapid tachycardia would suddenly break, devolving into bradycardia, a dangerously slow rhythm, before racing off again. Her blood pressure continued its relentless fall. It became chillingly clear to everyone in the room that they were losing her. Her heart was failing. The call was made to start chest compressions. A nurse climbed onto a stool beside the bed and began the brutal rhythmic work of CPR, pushing down hard and fast on Gloria's sternum, a desperate, physical attempt to manually squeeze her heart and keep oxygenated blood flowing to her brain. The quiet focus of the room was now punctuated by the grim count. 1 and 2 and 3 and 4. They charged the defibrillator paddles. The high-pitched whine of the machine filled the tense silence between compressions. Dr. Gurchinsky took the paddles, smeared them with conductive gel, and placed them firmly on Gloria's chest. She glanced at the monitor, then at her team. "Clear!" she shouted, a command for everyone to break physical contact with the bed. She pressed the buttons. A powerful jolt of electricity surged through Gloria's body, her muscles arching violently off the bed in a silent, grotesque spasm. On the monitor, the chaotic line of her heartbeat wavered, straightened for a terrifying second, then returned to its frantic, deadly dance. They tried again. More compressions. More breaths forced into her lungs. More drugs. They charged the paddles to a higher energy level. Clear. Another jolt. Another violent arch of her body. And again nothing. Her heart refused to be tamed. It was in the midst of this frantic, high-stakes battle for her life, a battle they were clearly losing, that the first threads of high strangeness began to weave themselves into the scene. These were subtle things at first, oddities that were noted by the professionals in the room but quickly filed away in the back of their minds as they focused on the immediate, life-threatening crisis. One of the nurses who touched Gloria's skin to place an EKG lead noted an unusual, oily sheen covering her body. It wasn't sweat, which they were all familiar with. This had a different texture, a greasy quality that was strange and unnatural. Then Maureen Welch, the respiratory therapist, as she leaned in close to Gloria's face to manage her airway, detected a strange odor coming from her mouth. She would later describe it as fruity and vaguely garlicky. This was unusual, but not entirely unheard of. Diabetic ketoacidosis can produce a fruity smell on the breath. Certain poisons can produce a garlicky smell. In a patient with multisystem failure and potential uremia, strange metabolic byproducts can create unusual odors. The team registered the oddities as minor, secondary data points and pressed on with the resuscitation. They were professionals trained to focus on the signal, not the noise. They had no idea that what they thought was noise was about to become the signal, a terrifying siren warning them of an encroaching danger they couldn't comprehend. The critical moment, the instant where the incident irrevocably shifted from a tragic but understandable medical case to a full-blown unexplained phenomenon, came with a simple routine blood draw. Dr. Gurchinsky needed to check Gloria's arterial blood gas levels. It was a standard procedure, a crucial diagnostic tool. It would tell them the balance of oxygen and carbon dioxide in her blood, reveal its pH level, and give them a vital snapshot of her metabolic state. She ordered a nurse to draw the sample. That nurse was Susan Kane, a seasoned professional, a veteran of countless ER crises. She took a 10 cubic centimeters Vacutainer syringe, a standard piece of equipment used thousands of times a day in every hospital in the world. She swabbed Gloria's right arm with an alcohol pad, palpated for a viable vein, and with the practiced ease of long experience, expertly inserted the needle. As the dark venous blood, starved of oxygen, began to flow from Gloria's body and into the glass vacuum tube, the very atmosphere in Trauma Room 1 seemed to change. It was as if a switch had been flipped. A smell hit them. It was not the fruity, garlicky odor from before. This was something else entirely. It was a sharp, pungent, powerfully chemical odor. It was an industrial smell, not a biological one. Several people in the room, including Dr. Gurchinsky and Susan Kane, identified it instantly and independently. It was the unmistakable acrid smell of ammonia. The powerful, eye-watering scent seemed to be emanating directly from the syringe of blood in Susan Kane's hand, as if she had drawn a sample of pure household cleaner. Then came the second and far more profound impossibility, a sight that violated the fundamental laws of human biology. Susan Kane looked down at the blood she had just drawn from a human being. Floating inside the dark red liquid were strange small particles. She stared, her mind refusing to process what her eyes were seeing. They weren't blood clots. They were distinct solid particles. She would later describe them as being manila-colored. The pale, buff, yellowish-brown of an office filing folder. They were crystalline in appearance, like tiny shards of some unknown substance, suspended in the plasma. Everyone in the room knew, with the absolute bedrock certainty of their medical training, that this was wrong. This was not something that happened. Blood is a liquid tissue. It does not spontaneously form solid, manila-colored crystals. It was biologically, fundamentally impossible. Susan Kane, holding the syringe as if it were some strange and dangerous alien artifact, held it up for Dr. Gurchinsky to see. Her voice was laced with a mixture of professional curiosity and dawning disbelief. "Julie, look at this," she said. "Does this look right to you?" As she spoke those words, a wave of intense, prickling heat washed over Susan's face. Her skin began to feel as if it were burning, a sudden severe sunburn radiating from the inside out. A dizzying nausea rose in her stomach, and the bright, sterile lights of the trauma room began to swim and blur before her eyes. The floor seemed to pitch beneath her feet. She knew she was going to faint. With her last conscious effort, she quickly passed the toxic syringe to a nearby medical student and stumbled back from the gurney, away from the source. "I don't feel well," she managed to say, her voice weak and distant before her knees buckled. Her body went limp and she fainted, collapsing in a heap onto the cold linoleum floor. A wave of confusion, mixed with a dawning primal fear, rippled through the room. A nurse fainting during a stressful code blue was not unheard of. The stress, the emotion, the physical exertion could take their toll. But this felt different. It felt directly connected to the strange blood, to the impossible crystals, to the powerful ammonia smell that was still hanging thick and heavy in the air. Dr. Julie Gurchinsky took a step forward, her medical training kicking in, moving to assess her fallen colleague. As she did, she too felt a dizzying wave of lightheadedness. The room seemed to tilt on its axis. A terrifying tightness constricted her chest, making her feel as if she were breathing through a wet sponge. She couldn't draw a full, satisfying breath. The medical term is apnea, the cessation of breathing, and she was experiencing it. Realizing with a surge of pure adrenaline that something was terribly wrong, that she was also being affected by the same invisible agent, she turned and forced her body to move to get out of that room. She managed to stumble through the doorway, and as far as the central nurse's station before her own body betrayed her. Her legs gave out and she collapsed to the floor, falling amongst her colleagues, gasping desperately for air. Now real panic, a thing rarely seen in a seasoned ER team, began to set in. The respiratory therapist, Maureen Welch, had been one of the first to rush to help move the unconscious Susan Kane out of the way. As she stood near the doorway of Trauma Room 1, her own nervous system went haywire. Her limbs started to shake uncontrollably in violent spasms. A frightening numbness, a pins and needles sensation, spread rapidly through her hands and feet. She too collapsed, her body twitching on the floor. One by one, like soldiers being picked off by an invisible sniper, the medical staff who had been in closest proximity to Gloria Ramirez were being struck down. A horrifying domino effect of sickness was cascading through the emergency department. The orderly, controlled environment had completely dissolved into a scene of chaos and sheer terror. The enemy was no longer just the abstract concept of death that was claiming their patient on the gurney. There was something else in that room, something tangible yet unseen, something toxic that was now actively, physically attacking them. Dr. Umberto Ochoa, who had been helping with the resuscitation but was fortunate enough to be slightly further from the blood draw, saw his friends and colleagues falling around him. He heard the panicked reports of the strange smells and the impossible crystal-laden blood. He took command of a situation that was spiraling into utter madness. He made a decision that was both drastic and absolutely necessary. He shouted the order, his voice cutting through the growing panic. "Evacuate! Evacuate there now!" The scene that followed was one of surreal, organized crisis. The remaining healthy staff, their faces pale masks of fear and disbelief, began to move with desperate urgency. All ER patients, dozens of them, including people with serious injuries, heart conditions and illnesses, were wheeled on their gurneys and in their wheelchairs out of the building and into the cold, dark air of the hospital parking lot. A makeshift open-air triage and treatment center was hastily set up under the dim orange glow of the parking lot lights. Doctors and nurses, shivering in their thin scrubs, struggled to continue caring for their patients while trying to process the unbelievable events that were still unfolding. The entire emergency department of Riverside General Hospital, a multi-million-dollar facility, was now considered a potential contamination zone, a hot zone, as dangerous and unpredictable as a chemical spill. At 8:50 p.m., amidst the chaos of the evacuation, what was left of the medical team still working in Trauma Room 1, now likely wearing protective masks, pronounced Gloria Ramirez dead. Her heart had finally irrevocably given out. But her death was not an end to the horror. In a very real sense, it was just the beginning of an even deeper, more complex, and more terrifying mystery. Her body, lying still and silent on the gurney, was now Exhibit A in a medical and forensic investigation unlike any other in history. It was no longer just a body, a vessel of a human life. It was now a potential biohazard, the source of an unknown and virulent poison. The hospital administration, now facing a major crisis, immediately contacted the Riverside County Department of Environmental Health. The county's hazardous materials team, the hazmat team, was dispatched with the highest priority. They arrived on the scene looking like figures from a science fiction movie, clad in their bulky, fully encapsulated, level-less suits. These bright yellow or green suits, with their large helmets and their own self-contained breathing apparatus, sealed them off completely from the outside world. They were prepared to face a chemical or biological agent of unknown lethality. They entered the now deserted ER, their movements slow and deliberate. They swept the area, particularly Trauma Room 1, with their sophisticated sensors, devices designed to detect a wide range of known volatile toxic agents: hydrogen cyanide, phosgene, mustard gas, nerve agents, industrial chemicals. Their instruments found nothing. The air in the ER, by the time they were able to test it, was clean. The mysterious toxic fume had either dissipated completely in the evacuated, open space, or more chillingly, it was a substance that their state-of-the-art sensors were not designed to detect. This negative result only deepened the mystery and heightened the fear. If it wasn't a known toxic gas, what was it? All eyes, both literal and metaphorical, turned to the body of Gloria Ramirez, still lying in the now abandoned Trauma Room 1. The fear surrounding her remains was palpable. No one wanted to go near her. No one wanted to touch her. No one knew what had emanated from her body, or if it could happen again. An extraordinary and unprecedented containment procedure was devised, a protocol born of pure fear of the unknown. 2 hazmat workers, brave volunteers from the team, prepared to enter the hot zone. They slowly and carefully entered Trauma Room 1. With painstaking care, they lifted Gloria's body and placed it into a specially designed, hermetically sealed aluminum casket. This was not a normal coffin. It was a rugged, industrial-looking container with rubber gaskets and locking clamps, designed for the transport of hazardous materials. It looked more like a container for a dangerous pathogen from a biocontainment lab than something used for a deceased hospital patient. The sealed casket was then wheeled out of the ER and transported to a refrigerated and isolated chamber in the county morgue, a vault within a vault. The mystery of the toxic lady was now locked inside a metal box. But the human toll of that night was still being tallied. In total, an astonishing 23 of the 37 staff members who had been working in the ER that evening experienced at least one symptom, ranging from dizziness and nausea to severe respiratory distress and fainting. Of those, 5 were hospitalized with serious debilitating reactions. Their symptoms were a bizarre and terrifying collection of ailments: shortness of breath, nausea, vomiting, uncontrollable muscle spasms, burning skin, and fainting spells. For most, the acute symptoms subsided within a day or two, leaving them shaken and traumatized but physically recovered. But for the 2 women who had been at the absolute epicenter of the event, the ones who had been closest to Gloria and her impossible blood, the ordeal was far from over. Susan Kane, the nurse who had drawn the blood and been the first to fall, was hospitalized for 2 weeks. She suffered from persistent breathing problems and was diagnosed with hepatitis and pancreatitis, serious and painful inflammations of the liver and pancreas. It was a debilitating and frightening illness that would take her months to fully recover from, leaving her with lasting health complications. Dr. Julie Gerchinsky, the dedicated resident who had led the heroic fight to save Gloria's life, suffered the most severe and life-altering consequences. She spent weeks in the intensive care unit, at times in critical condition. She too developed pancreatitis and hepatitis. But most disturbingly, she was diagnosed with a vascular necrosis, a painful and degenerative condition where bone tissue begins to die due to a lack of blood supply. The unknown toxic agent she was exposed to for a matter of minutes had somehow attacked and destroyed the tiny blood vessels that fed the bones in her knees. This agonizing condition would plague her for years, requiring multiple surgeries and forcing her to walk with crutches for the rest of her life. Her promising career as an emergency room physician, a physically demanding profession she loved and had trained for tirelessly, was ended in a single night by 37 minutes of exposure to an unknown toxin from a dying patient. The incident at Riverside General Hospital was now a full-blown public health crisis and a burgeoning media sensation. The story was so strange, so cinematic, so perfectly tailored for a headline, that it was irresistible. It was picked up by newspapers and television stations across the country, and then around the world. The narrative quickly solidified around that chilling, easy-to-digest headline: the toxic lady whose mysterious fumes had felled an entire roomful of doctors and nurses. The case became a modern urban legend, but one that was terrifyingly real, with real victims suffering real life-changing harm, and a body so dangerous it had to be locked away from the world. And so the long, terrifying night of February 19, 1994, finally came to a close, leaving behind a set of profound and terrifyingly unanswered questions that hung in the air like the mysterious fumes themselves. What was the oily sheen on Gloria's skin? What was the source of the fruity, garlicky smell on her breath? What, in God's name, were the impossible manila-colored particles floating in her blood? And what was the powerful, ammonia-like fume that had emanated from her very veins and struck down 23 people, hospitalizing 5 and crippling 1 for life? Was it an exotic, unknown virus, a new pathogen emerging from a sick patient? Was it a bizarre, mass psychosomatic reaction? A case of mass hysteria triggered by a strange smell in a high-stress environment? Was it a chemical contaminant she had been exposed to before arriving at the hospital, something she had brought in with her? Or was it something else entirely, something far stranger, a unique and deadly chemical reaction that had taken place inside her dying body, turning her into a walking chemical bomb? The only clues, the only possible answers to this extraordinary medical mystery, were locked inside that sealed aluminum casket with the body of Gloria Ramirez. The county coroner, the medical examiners, and teams of elite scientists from some of the nation's top forensic laboratories were about to embark on an investigation that would push the very limits of forensic science. They were about to unseal the box and confront the mystery of the toxic lady head-on. Thank you for joining us for this first detailed part of our deep dive into the Gloria Ramirez case. The events of that single night in 1994 remain one of the most chilling and persistently perplexing medical mysteries on record. A true story of an unexplained illness that had devastating and life-altering consequences for those who were simply trying to do their jobs and save a life. If you found this detailed account as gripping and unsettling as we do, please consider showing your support by liking this audio, subscribing to our channel, and clicking that notification bell. It is the best way to ensure you don't miss the next chapter of this incredible story, where the scientific investigation begins in earnest and the theories become even stranger. And now we turn the conversation over to you. Having heard this exhaustive account of the night, what are your initial thoughts and theories? What could possibly explain the bizarre phenomena observed by a room full of highly trained and experienced medical professionals? Do you believe this was an external contaminant, a case of mass hysteria, or did something unprecedented happen inside Gloria Ramirez's body? Let us know your ideas, your questions, and your analysis in the comments section below. We read every comment and are genuinely eager to hear your perspective on this profound mystery. Be sure to join us for part 2, as we follow the investigators who dared to unseal the casket. We will delve into the autopsy, the conflicting scientific theories that emerged, the accusations of a hospital cover-up, the emotional turmoil of the Ramirez family as they fought for answers, and the strange, elegant, yet highly controversial chemical explanation that was finally offered for the night the toxic lady came to Riverside General. Until next time, sleep well, and remember that sometimes the most frightening and unbelievable stories are the ones that are entirely verifiably true.